So I've been involved in the laser and device business for quite some time. And in 2016, I really believe that the INFINI device provides the most tightening and skin rejuvenation of anything that I've seen in this class. So I evaluated many devices, and when I really came down to the science, I believe the INFINI provides the most tightening for the effort and the least amount of downtime. So I want to discuss insulated versus non-insulated needles. So the INFINI device has insulated needles, meaning that the device needle goes into the skin and the energy is at the tip of the needle, as opposed to a non-insulated needle, in which case energy is throughout the whole needle. So there's probably a role for both of these types of devices out there. However, I really like using the INFINI device because I know where the energy is being delivered. There's less epidermal injury, and I know I can combine this with other technologies when I want to include epidermal injury. Also, those needles are placed in different levels, so I have complete control over the depth of placement of the needle and the size of the injury I create with this energy. So initially, when I first started using the INFINI device, we marketed this and used it on existing patients. But what's happened over the last year or so is that existing patients have told other patients, and we've seen patients coming in asking for the INFINI device. So it's a good marketing device for our practice, in which case it's bringing in new patients into the practice. So as with any new technology, when INFINI first was introduced to our practice, I did it. Why? I wanted to establish efficacy and the safety profile. But after using it for a while, I was able to delegate it. So we're at the point now where we have other physicians and extenders in the practice who fight over this device. So it's definitely a device that is delegatable, and due to the high safety profile, really I feel comfortable with having anyone in the office who is trained to use it. So INFINI has become our go-to device for acne scarring. When a patient walks into the practice with acne scarring, at this point we go over their options, but in my view in 2016, this is my go-to device, and there's nothing better than INFINI for treatment of acne scarring. The issue is, though, that the patients are going to need more treatments than the typical 3 treatments for skin tightening. So I tell the patient, you're going to continue to see improvement, but you might need some additional treatment. And the settings are probably going to be a little deeper on the acne scarring, because that's the beauty of the device. You get to adjust the settings based upon the pathology. And acne scarring is often a little thicker, so we might need to be a little deeper than we would for our typical skin tightening procedures.